Doctor, when it comes to replacing someone's hip, what do you discuss with the patient before surgery?
We discuss the possibilities of the procedure in terms of what will actually be done. And we talk about the pain medication regimen so that they know what to expect. There are new techniques evolving every day to control pain, which is something we're trying to grasp a handle on, but it's the practice of medicine and something that we need to perfect as a profession. And then, unfortunately, we have to discuss complications, because that's the part that, no matter how much you try and plan and predict, things happen out of the ordinary, and you just have to be ready to deal with it.
Right. So there are total hip replacements and partial hip replacements, right? So how do you make that decision, and what's the difference between the two?
So when somebody comes to the office to get evaluated for a hip replacement, they're usually coming in for evaluation of a whole joint being replaced, both the cup, the ball, and the socket. The partial hip replacement is usually done in the fracture setting when somebody breaks a hip and needs something replaced right away. And then we look at the patient's overall functional status, in terms of how active is the patient, and how they're living their life. If somebody's a golfer and walks 3 miles a day and just trips over a curve or a pothole, they're probably going to get a total hip, versus a patient who's more sedentary and just needs to have the hip fixed and partially replaced in order to get back to living around the house.